My name is Kathleen Jones. I'm the director for Mountain Right to Life, a California licensed medical facility. I could not be more in favor of providing health care for children, especially those in rural and underserved areas. Providing such health support through schools makes good sense and is vital to our communities. In my job, I see firsthand the devastating effects of homelessness and poverty on women and children. It's our duty to care for those who have little or no access to resources. You and I must stand for those in need of assistance. But abortion is not assistance. And as someone who has cried with women who regret their abortions moments and years later, I can tell you that providing school-based health center support program that includes abortion is not the kind of health care our children need. Chemical abortions account for the majority of all abortions in the United States currently. Injury from these chemical abortions include heavy bleeding requiring surgery, infection, sepsis, pelvic inflammatory disease, endometriosis, anxiety, mental depression, up to death. AB 1940 will facilitate giving these same chemical abortion pills to grade school and high school girls through these school-based health centers, just like SB 24 mandates California public colleges. And working in concert with the pro-abortion laws already on the books and those bills currently in committee, AB 1940, if passed, will ensure that even physician assistants located at school-based health centers can give chemical abortion drugs to 12-year-old girls secretly without parents' knowledge and without a doctor's direct supervision. But what if a girl takes the chemical abortion pill and changes her mind? Can she go back to the school nurse to start a progesterone treatment to offset the mifepristone? Is that included in the reproductive health care? Google bans advertising for abortion pill reversal, which is the progesterone treatment, even though it's a life-saving treatment for the baby and possesses no risk to the mother. So who decides what is the appropriate school-based health care? Politicians or the parents? For these reasons, I ask you to oppose AB 1940 unless amended to remove the phrase reproductive health services throughout the bill.
Hello, my name is Elizabeth Rangel. I'm the youngest of 12 children. I'm a United States veteran. I have served in the United States Air Force Reserves and worked as a Law Enforcement Correctional Officer for 27 years. I'm currently a children's pastor and I oversee a children's ministry at my church. I'm a proud grandparent of 10 grandchildren. With AB 1940, California is doing something it has never done before by providing direct state funding for school-based health centers. It can help support generations of children, especially in underserved areas, with access to a nurse and a level of health care. But AB 1940 goes beyond health care to enable abortion through the schools, behind the backs of parents, destroying the child and parent bond. Abortion leaves emotional and sometimes physical scars on children. I know. I have 3 living children and I have had 4 abortions. So I'm readily familiar with the process and the devastating regret and shame I have suffered for more than 30 years. Abortion hurts. I know many mothers who have had abortions, and some were never able to have children. Some of them were led on a path of drug addictions, alcoholism, suicide. The shame and regret is real and can last a lifetime. As a sidewalk counselor, I have personally witnessed school resource officers bringing in young girls as young as 12 years old for abortions at the abortion clinics. They are young and they are naive and scared to tell their parents. I have personally walked side by side with some of these young moms that were afraid. I have watched these scenarios play out. I have pictures of these babies and their moms, and they are all very thankful someone was there to guide them in the right path. It is very important to have a strong pro-life advocate, not someone who believes abortions is the answer. As women, we are not promised children. Teachers and school nurses shouldn't be abortion advocates, but that's what AB 1940 will do. The bill changes the Health and Safety Code to authorize these new school-based health centers to provide primary medical care that includes reproductive health services through mobile health and telehealth. Reproductive health services is a code for abortion. That means AB 1940 will direct state funding for school-based health centers to provide abortion services to children on school campuses through the state. The next step will be to provide abortion pills to grade schools and high school girls on school campuses through these school-based health centers. Because the State Department of Education will be in charge of administering the new school-based health program under AB 1940, the people who are in charge of educating our children will also be in charge of providing chemical and surgical abortion services through the schools on campuses. As a parent and a grandparent myself, I can say parents want to know their children are safe when they are at school, not coerced into making a life decision without their parents' knowledge. I'm talking about our children, your children. Please amend AB 1940 to remove the divisive issue of abortion funding in our schools.
Thank you very much. So we'll go to other witnesses.